All right, let's go ahead and get started. Hold on one second here. Okay. All right, let's go ahead and get started. Thanks for joining us for our weekly COVID-19 briefing. We have Kevin Dick, the District Health Officer for Washoe County, on today, and he is our sole guest. So Kevin, if you're ready, please go ahead and get us started.
Yes, good morning. Thank you, Scott, and thanks everybody for joining us today and for your continued efforts to provide information for our community on the COVID-19 pandemic. We're continuing to have high numbers of cases occurring daily in Washoe County. So we are in elevated disease transmission levels. Our 7-day moving average of new cases is 100 cases per day. And we've had 4 days in the last week where we've had in excess of 100 cases per day that we're reporting. So it's important to understand that we're continuing to have active spread in the community. We have cases that are occurring in workplaces. We're continuing to see cases that are occurring from parties, household gatherings, weddings, etc. And so anytime that you have a group of people that are getting together, there's the risk for COVID-19 transmission. When you're out and about running errands or when you're in your workplace, there's the risk of transmission because we have so many cases in the community that are occurring right now. So we have a high number of active cases. We have 1,329 active cases as of yesterday. With the large number of cases that we're receiving on a daily basis, we also have delays in getting the disease investigation done to be able to identify the close contacts and have them quarantined. So we continue to ask for everybody's assistance in working together to beat COVID-19 by wearing masks, socially distancing, washing hands. Those are the best things that we can do. As Dr. Fauci said the other day, we need to hunker down still to be able to reduce the spread of disease in the community. I'd like to also report to you, we've had some excellent communications occurring with the governor and his staff in response to the concerns that we had regarding the local health authorities' inclusion with the state discussions and policy. And I think we're on a great track moving forward with that team. Also wanted to mention, we're operating the post, the drive-through testing at the Reno Livestock Events Center. And that's free testing that's available for anybody in the community by either calling us or visiting the website and doing the risk assessment. But we've been experiencing a high number of no-shows, people that schedule to get tested at the post and then don't show up. So we had 160 no-shows during the last 2 week of testing, and that's about an 18% no-show rate. So we're really also, we really need people to help us out. If you are not going to come to get tested and you were scheduled for testing, if you could please cancel through the online platform your scheduled test, or give us a call at the 328-2427 number. Please let us know if you're not going to show up for testing. That way we can make your slot available for somebody else to get tested sooner. As we go through this COVID-19 pandemic, and I know everybody is tired of it, we also need to be aware that we face other hazards. I think everybody's been acutely aware of wildfires recently. We have the potential for flooding here and also for earthquakes. We're in earthquake country here in Nevada. And so I'd like to also remind everybody that tomorrow, October 15th, is the Great Nevada Shakeout. And at 10:15 a.m., we have drills to exercise and remind us of the importance of being prepared for earthquakes and responding quickly if we do have a quake by ducking, covering, getting under a desk or a table, etc., and holding on. So again, that's at 10:15 tomorrow. We'll be having drills here at the county, and I would encourage everybody in your workplace, your homes, etc., to be aware of earthquakes and take this opportunity at 10:15 tomorrow morning to practice what you'd do if we had a major earthquake. So that concludes my remarks today. Scott, I'd be happy to take any questions.
All right, if you have questions, go ahead, fire away, or put it in the chat and we'll read it out loud.
This is Paul Nelson with 2 News. So the case where the Reno man tested positive for coronavirus 2 different times, that study was now published in one of the medical journals. How important was it for this to be published?
I think it's very important work, and I'm proud of the work that our epidemiology program manager, Heather Kerwin, did along with Dr. Pandori at the Nevada State Public Health Lab. I think it's important in several ways. One, that it's the first time in the U.S. that we've identified somebody that contracted COVID-19 twice. And also to know that they actually were sicker the second time that they had COVID-19 than the first. And I think it's important as well because with the publication in the Lancet that's happened earlier this week, that is a peer-reviewed article now that's being published, and not just a pre-publication information like we had a while back. So that means that the study is very valid. It's had rigorous review by other scientists. So the results are very important for us to understand that not everybody that gets COVID-19 is going to have immunity, even during a fairly short term moving into the future.
And what does that mean for natural immunity? And then once a vaccine comes, because I think the article mentioned that usually with vaccines, with other coronaviruses, it'll last 1 to 3 years. So there could be differences in natural immunity versus vaccinations, right?
That's correct. It doesn't mean that the vaccine is not going to be effective. Still the vaccines are being developed and tested, and we'll know more as we move forward. But one should not take those test results to say the vaccine isn't going to work. I think it's just a reminder that if people have had COVID-19 and think that they're bulletproof now because they had it, they should be more cautious and be aware that there is a potential they could contract it again.
Does it mean that herd immunity could be tougher to achieve?
I think it means that there could be some limitations to herd immunity as far as if we do have a waning immunity that comes from just a case that's a wild strain that's caught versus a vaccine, that we may not achieve that herd immunity over a sustained period of time.
Any more questions?
Yeah, if anyone else doesn't have any other questions, I'll have a few more. UNR is also doing the rapid test study. Could that be pretty valuable moving forward?
Potentially it could be. I really don't know more about that study than what we all saw in the news the other day. I think that what I read was that they're now working on validating the study, and so that's going to be very important work to understand how specific and reliable the test will be. But the idea of a simple test that you don't need to have a full lab to run, that you could get results in 30 seconds is fairly exciting.
And then also early on during this pandemic, we talked a lot about flattening the curve. And back then, the curve was a lot smaller than it is today. Yet people seem to be going back to their normal lives, and the restrictions aren't as strict as they were back then. Why is that?
Well, I think that we have COVID fatigue going on, and people want things to be back to normal. And unfortunately, it doesn't look like we're going to be normal for a while. So what we've seen occur is we've had some times when we've flattened the curve and then we've relaxed, and we've had surges so that we basically keep building up to new plateaus. So we'll surge and flatten and we'll move down a little bit, and then we'll surge even higher and flatten and move down, and then we'll surge even higher. So our curve is really over the longer term not flattened, and we've continued to have increasing numbers of cases in Washoe County. And while it's important that we do bring our economy back, the way to do that is to wear a mask, socially distance, and be careful when we're out and about, so that we are continuing to suppress the spread of the disease. I think we can be successful if people are all following those behaviors to be able to reopen the economy and suppress the disease. But what we've seen is people are continuing to have gatherings where people are getting together and they're not taking those precautions. They're not necessarily taking those precautions when they're out and about, and that results in additional spread of disease.
And then there's also some Reno City leaders that are pretty critical of the decision to keep the crowd size limitations low, despite what the governor's directive allowed. What's your response to that?
Well, we're seeing our very high levels of disease transmission occurring in Washoe County. We've been flagged for 3 weeks in a row after having only a week off of not being flagged by the governor's county tracking system. So it's no surprise that we're not in good place with COVID-19 and transmission in Washoe County. The governor's directive provides for gatherings of up to 250 now. That's 5 times the size of gatherings that we had just a short time ago. And so it's, I think, very unwise for us to just fling open the gates to allow even larger gatherings to occur until we see what happens with the increase in those gatherings. With that said, we did visit Greater Nevada Field for their soccer match on Friday, and congratulations on the big win there. They were able to show us how they were managing that group of people and discuss the plans for even a larger group gathering there. We were able to work with them on some areas that we thought could be improved in the way they managed that. They had submitted an additional plan to us that they updated based on our discussions and some concerns. And we provided our approval for that plan yesterday for a larger gathering for the match this weekend. So as I announced when we issued our release on the gatherings, on a case-by-case basis during the period that we want to take to see what happens with those gatherings of 200 up to 250 people. On a case-by-case basis, we're willing to consider larger gatherings that occur outdoors in fixed seating venues. We recognize that outdoor events do provide for a better environment for suppressing the spread of disease than indoor events do. And so we considered this one on a case-by-case basis. We considered the performance that we saw there, not just from the soccer team, but of the management and the fans on Saturday, and decided that we could approve this event occurring with more people there.
Hi, Shaditi from This Is Reno. One quick question if the previous person is done. Okay.
Yeah,
so
go for it. I'm done.
Okay, yeah, thank you. So my question is in regard with the UNR. So once a student or a faculty member tests positive and goes into quarantine, what are the rules or directives in place? Like, how many times are they tested before they're allowed back in the class or in the lab or in the building? Is health district involved in that process? Does it have a directive that it shares with the UNR?
So I can speak to what our protocol is with the health district, but I'm not going to speak on behalf of UNR on any protocols that they have. But our protocol is that when somebody is test positive for COVID-19, then if they're symptomatic, they need to recover and not have a fever and have significant improvement in all their symptoms and be at least 10 days from the time of their symptoms onset and testing to then be released. And we don't require additional testing. This is consistent with the state and CDC guidance for release because we are aware that some people may test positive for some time period after they have recovered from COVID-19, just because they have fragments of that RNA that's circulating in their system, and it may not be a viable virus that's contagious. For people that are quarantined, then they need to be quarantined for 14 days. And if they don't develop symptoms during that 14-day period, we release them from quarantine. We encourage people that are quarantined because they're a close contact to be tested just to make sure if they're asymptomatic that we detect that case and control it. For asymptomatic cases that test positive and don't develop symptoms, then we require them to be isolated for 10 days from their positive test and not have symptoms, and then they can be released to be back out in the community.
Okay, and just one more follow-up. How realistic are these directives, keeping in mind the case of reinfection?
I'm sorry, how realistic are the directives?
In terms of not requiring a negative test following somebody's feeling good and doesn't have fever.
Oh, I think it's it's a standard protocol that's being used nationally. Is it going to be perfect in every situation? Probably not, but I think it's a well considered one, and one that doesn't leave people needing to be isolated unnecessarily for long periods of time just because they're still getting a positive test that may not indicate a viable virus.
Thank you.
Hi, this is Lucia Starbuck, and I just wanted to ask, the city of Reno is increasing their clean and safe operations, so clearing spots along the river, and that does, lately they've been clearing homeless camps, and I know that does go against CDC guidelines. Can you speak, do you have any concerns about those operations increasing right now?
I think that what they're trying to do is to respond when they do have public safety concerns, and that they try to coordinate closely with human services to be able to identify if people do want to be tested in those encampments. But I think that's my comment. The homeless population has always been a very difficult issue, and it just has become much more complex and complicated with COVID-19 going on.
Are you concerned that when camps are kind of broken up and people go into different parts of the community, are you concerned that that could increase the spread of the virus?
I think there's the potential for that to spread the virus, but I think that we're not really in lockdown anymore, and we're opening up bigger and bigger events, and so I don't think that the homeless population right now is my biggest concern on where we may be seeing spread.
Thank you.
Hey, Kevin, Scott Sonner at AP. Back on the Greater Nevada field, what was the number of people they had last time? What sort of numbers are you looking at going forward? And have you had any discussions with UNR about Mackey Stadium for future football games?
Yeah, thank you, Scott. I'm afraid I can't give you the exact number off the top of my head, but I'll have Scott follow up with you with that. But I can tell you that they were up to 250 people this past Saturday, and apparently they did have some people for the game. So it was somewhere under 250 individuals that they had there. And I believe that their plan for this coming weekend is for a number of fans that's slightly under 700, but I'll have Scott confirm that and get back with you on that. I guess the other thing I need to add is while we provided our approval for their event yesterday, they also do need to get the state business and industry approval for that. And my understanding is that they're working with them on that now.
And as far as UNR Mackey Stadium,
I'm sorry, Scott, I forgot that piece of your question. I haven't had any conversations or follow-up with UNR regarding Mackey Stadium.
Any other questions for Kevin Dick? All right, hearing none. Thank you all for joining us. We have this recorded and we'll put it on the COVID-19washoe.com website here in the next hour or so. Thank you very much, and let me know if you have any questions.